Hello everybody. In this video I will use a torso model and a separate model of the urinary system to show you some major part of the system. Okay, so organs of the urinary system. The major organs are kidneys. So over here on this model you can see right and left kidney. You can see that right kidney is a little bit lower than the left kidney because of the big organ over here that is removed right now, but it's a liver. So liver occupies so much space that it pushes right kidney a little bit lower compared to the left kidney. Now this structure over here and over here are ureters, right ureter and left ureter. And what they do, they carry urine formed by kidneys to the urinary bladder. So here you can see a urinary bladder that is anterior to the rectum. Also, we can open up the urinary bladder and see some extra structures. So this muscle, the smooth muscle that make the wall of the bladder, is the detrusor muscle. Inside, we will have transitional epithelium, and it will form special structure called rugae. Now, this triangular muscle is called trigone. And trigone is formed by 1, 2, 3 opening. This is opening of the right ureter, opening of the left ureter, and urethral opening. All right. Another name for this opening is orifice. So it would be ureteric orifices and urethral orifice. Also, we can open up the kidney. So you can see in a kidney, kidney will be covered by a fibrous capsule. This part is called renal cortex, and this part is renal medulla. Now this inner part is a renal sinus, and inside the sinus we will have calyces, minor, major calyces, and a pelvis. Okay, so cortex is a granular structure, and in the medulla this structure is called medullary pyramids. So each medullary pyramid has this little papilla that opens up in a minor calyx. So this part of the tube is called minor calyx. Now this is one minor calyx, this is another minor calyx. When they combine together, they form the structure that is major calyx. Then all major calyces combine, making the renal pelvis. And then pelvis continues as a ureter, right, to the urinary bladder. Okay, now in this model over here, we can see some additional structure. So we can see inferior vena cava, abdominal aorta, renal artery, red structure, renal vein, the blue structure. Also, if you look at the kidney, we will see the adrenal gland sitting on the top of each kidney. The kidney itself has the fibrous capsule. So this brown structure is fibrous capsule. Now this part over here is the cortex, right? So over here. And then this is the medulla. And you can see medullary pyramids with papilla, minor and major calyces, and pelvis. Also, we can see ureters, right? So it's one ureter, right ureter, and left ureter that brings urine to the urinary bladder. So I'm gonna turn it, the model, right? And I will open up the urinary bladder, right? Okay. So we can see it better. So one half, and here's another half. And this is a model of male urinary system, because this structure, greenish structure, is prostate gland. Okay, so again, that's urinary bladder. It has detrusor muscle, rugae, trigone, this white structure over here, and this is the urethra. Also, this part over here and this where the detrusor muscle kind of comes to the internal urethral opening over here, or orifice. This is internal urethral sphincter that is made of smooth muscle, and it's under involuntary control. All right, so this part over here is called internal urethral orifice, and external urethral orifice will be at the very end of the urethra. That is not shown over here. Only part of the urethra is shown. Okay, on the other side, sorry. Okay, you can see some extra structures. So that's a prostate gland. These two glands over here are called seminal vesicles, and this structure is called ampulla of the ductus deferens. And this is a part, all this, a part of reproductive, male reproductive system that will be covered in a separate lecture. Okay, so that's it for these two models. Thank you for watching.